Today, we're digging into something called acute kidney injury, or AKI for short. And it's exactly what it sounds like. It's when your body's essential filtration system suddenly, and pretty seriously, just stops doing its job.
I mean, really think about that for a second. Your kidneys, they're like this incredible non-stop cleanup crew for your blood. So what happens when that crew just walks off the job? Well, that's what we're here to figure out.
All right, here's how we're going to break it all down. First, we'll take a look at the system when it's running perfectly, the body's filtration plant. Then, we'll see what happens when that system gets clogged up. After that, we'll put on our detective hats and investigate the three main types of trouble, learn how to read the warning signs, and finally, figure out how to get things flowing smoothly again.
So before we can understand what goes wrong, we've got to get a handle on what right looks like. The best way to think about your kidney is like a super sophisticated coffee maker. Blood comes in, and it goes into millions of these teeny little filters called nephrons. And inside each nephron, you've got the star of the show, the glomerulus. That's your filter paper. It separates all the good stuff, your blood, from the waste products like creatinine, which are basically the used coffee grounds that need to get tossed out.
Okay, so how do we know how well that filter is actually working? Well, we've got a number for that. It's called the glomerular filtration rate, or GFR. You can think of it as the performance report for your kidney. A high GFR, that means the cleanup crew is on top of its game. But a low GFR, that tells us there's a problem on the line.
All right, so now that we know how this amazing system is supposed to work, let's talk about what happens when it suddenly doesn't. And that brings us to acute kidney injury. The really important word here is acute. It means this happens fast. We're not talking about a slow decline over many years. This is a rapid breakdown. The filters get jammed, and all that junk, creatinine, urea, starts piling up in the blood instead of getting flushed out. By the way, the medical term for that buildup is azotemia.
So how fast is fast? Well, there's one really clear signal that doctors look for. It's a sudden spike in that creatinine level in your blood. If that number jumps up by 1.5 times what it normally is in just 1 week, well, that's a huge red flag for AKI. It's the system screaming that it's failing, and it's failing now.
Now here's where it gets really interesting. Not all kidney injuries are created equal. To fix the problem, you first have to find out where the breakdown is. It's kind of like being a plumber. Is the problem with the water supply getting to the house? Is the filter itself broken? Or is the drain pipe completely clogged?
And that plumbing analogy lines up perfectly with the three main types of AKI. First, you've got pre-renal. That means the issue is before the kidney. It's a supply problem. Not enough blood is even getting to the filter. Second is intrinsic, where the problem is inside the kidney. The filter itself is damaged. And last, you have post-renal, which means after the kidney. This is your classic plumbing backup, a blockage somewhere down the line.
So let's look at that supply problem first. Pre-renal AKI is all about one thing: not enough blood flow. This can happen if you lose a ton of fluid, say from really bad vomiting or diarrhea. Or maybe your heart isn't pumping strong enough, or your blood pressure tanks during a serious infection like sepsis. Heck, even common medications like NSAIDs or ACE inhibitors can mess with the kidney's internal blood pressure, choking off the flow.
Okay, now what if the filter itself is the problem? That's intrinsic AKI. The most common cause, especially for people in the hospital, is something called acute tubular necrosis, or ATN. And that's basically when the kidney cells themselves start to die off, a lot of times because that pre-renal supply problem went on for too long and starved them of oxygen. Other causes can be inflammation of the filters or direct hits from what we call nephrotoxic drugs, think certain antibiotics or that contrast dye that's used for CT scans.
And finally, we've got the drainage problem, post-renal AKI. This one is all about a blockage. If urine can't get out, it backs up, creating pressure that starts to crush the kidneys from the inside. We're talking about things like kidney stones, an enlarged prostate in men, tumors, or even something as simple as a clogged urinary catheter. It's a literal plumbing obstruction.
So you have these three totally different types of problems. How in the world do doctors figure out which one is the culprit? Well, it's like a forensic investigation, and they've got a whole toolkit of tests to find the clues. The investigation pretty much always kicks off with a simple blood test. Like we said, when the kidneys are failing, all those waste products, creatinine, urea, they start to pile up in the blood. Seeing those numbers go way up is the first undeniable clue that the cleanup crew is in serious trouble. But this is where the real detective work happens, when you look at the urine under a microscope. Doctors are hunting for these things called casts. They're tiny little molds of the kidney's internal plumbing, and the type of cast you find is like a fingerprint. It tells you exactly what went wrong. For instance, if you see these muddy brown-looking epithelial casts, that points directly to acute tubular necrosis. Finding red blood cell casts suggests the main filter is inflamed, and seeing white blood cell casts, that's a sign of inflammation or infection in the kidney tissue. It is an amazing tool that can pinpoint the exact type of intrinsic injury.
Okay, so the investigation is over, the cause has been identified. Now the focus shifts to just one thing: fixing the problem and getting that filtration plant back online.
The first response is usually a pretty clear, logical three-step plan. Step 1, manage the flow. If it's a pre-renal problem because of dehydration, you give IV fluids. If the patient has too much fluid, you use diuretics to help get it off. Step 2, stop the damage. Go through every single medication and stop anything that could be hurting the kidneys. And Step 3, go after the root cause. Clear the blockage, fight the infection, support the heart.
And that second step is it's absolutely crucial. You wouldn't believe how many cases of AKI are caused or made worse by medications. That's why one of the very first things doctors do is a full med review to stop any of those potentially nephrotoxic drugs. It's such a simple action, but it can make a massive difference.
But what happens if those steps just aren't enough? Well, in really severe cases, a machine has to step in and do the job of the kidneys, and that's called dialysis. To help decide when it's absolutely necessary, doctors often use a handy acronym, AEIOU. A is for severe acidosis, when the blood gets way too acidic. E is for electrolytes, like dangerously high potassium. I is for intoxications from specific drugs or toxins. O is for fluid overload that just won't budge. And U is for uremia, when that waste buildup starts causing other serious problems. So, when you boil it all down, acute kidney injury is this sudden, serious breakdown of a vital system. But the amazing part is, by figuring out if it's a supply problem, a filter problem, or a drainage problem, doctors can often turn things around. It's a powerful reminder, right? Our kidneys are incredible, they're resilient, but they are not invincible. Which kind of leaves us with one last question to think about. Knowing just how much they do for us, how can we do a better job of protecting them from all the challenges they face every single day?